Today, the private practice of medicine, in my opinion, is becoming almost a dinosaur.
There are too many doctors involved with a disease process, and unless these things are coordinated well, there's going to be lots of reduplication and redundancy, and mistakes will be made.
We have to start working together as teams.
Having practiced for almost 3 decades, I think that there's been a huge shift.
Are we there yet? No. Are we in a much better place? Absolutely.
My name is Teresa Hensler, born and raised in Detroit, Michigan. Well, right now, at the present time, I have not been able to enjoy my hobbies. I've had a heart murmur, but 5 years ago, I had a heart attack.
When she came to see me, she was still a very frail, 81-year-old individual who was known to have some problem with one of her heart valves.
And I had to slow down on many things.
That she couldn't even read a book, something that she liked to do.
And I was assisting my husband. The doctor said, no, you cannot do that anymore.
And without doing anything, she probably didn't have more than about 4 or 5 months to live.
It's depressing. You want to be your old self, you know.
The structural heart program is a concept to integrate cardiology, cardiovascular surgery, and cardiac imaging into one area. Primarily, we've been dealing with diseases of the aortic valve to fix the aortic valve without heart surgery.
After seeing Mrs. Hensler, I really didn't think that open heart surgery was a good option for her.
That's why she was referred to us to see if we could offer some way of fixing her heart valves without requiring an open heart operation.
Healthcare is very difficult to navigate for patients.
There are multiple steps that you have to go through.
You get frustrated, you know.
They're scared, they're anxious.
They don't know what's happening. They don't know if this is the end of their life.
And to be able to take that burden away from them.
You have to have a kind of a game plan.
So it was very simple. Simply got on the phone. I made one phone call to our coordinator.
They put you right at ease. They set up a schedule.
I think the structural heart program is a fantastic opportunity to use technology in ways that we've never done before.
The use of electronic medical records, it has helped us to share information together between institutions.
Where they can really coordinate care with very complicated patients.
It saves confusion, it saves redundancy.
And they were very in tune to my particular health. It makes you feel secure.
One of the critical things electronic medical records have allowed us to do is to, in real time, track outcomes.
So you really have to have a physician leader that says, look, this is the right thing for the patients, this is the right thing for the hospital, we have to change.
That never would have had that before if we hadn't been able to have this kind of teamwork.
They did the surgery.
Before it sounded like a broken washing machine. Now it sounds like a normal valve.
The process all went very good. Oh, they were wonderful. They really were. Yeah, they were fast, efficient, kind. They really were. No.
Do you have any favorites?
So very
Was he
kind.
cute?
Many times the patients who are coming from a distance for their follow-up care would prefer to stay in their community.
It's really difficult for these elderly patients to have to make repeated trips back and forth.
So we do have a telemedicine equipment available to us.
Well, this beats fighting all the traffic to come downtown Detroit, doesn't it?
Oh my gosh, yes.
It helps allay a lot of their anxieties, and I found that to be very useful.
In fact, I felt he was right in the room. I really did.
Equally important, the referring physicians from the outside institutions have to be brought into the picture so that they really understand what is happening to their patients.
So, Dr. Harrington, if we could take a listen to cardiac sounds.
Just a faint AI murmur, I think.
Saved my daughter time, saved my time. Yes, I would do that again. I would.
And she's now back living with her husband in their senior care facility.
I'm very fortunate to be given this second lease on life, you could call it. I'm alive. So I would say that's a very good thing.